Ever wondered how Canada's healthcare system works? Well, sit back and let's embark on a journey to understand this intricate system that has been the backbone of Canadian public health. When we talk about healthcare in Canada, we're referring to a system that's publicly funded, yet privately delivered. It's an interesting blend, isn't it? The Canadian healthcare system is not one single entity, but is composed of 13 provincial and territorial health insurance plans. Now, what does that mean? It means that each province and territory in Canada has its own health insurance plan. Each of these plans share a common commitment to provide all Canadian residents with reasonable access to medically necessary hospital and physician services without any direct charges. This publicly funded, privately delivered system is a unique characteristic of Canadian healthcare. The public funding comes from taxes, but the actual delivery of services is carried out by private entities. Think of it like a pool of public funds being used to pay private healthcare providers for their services. We should also note that while the system is publicly funded, it does not cover everything. Some areas of healthcare, such as prescription drugs, dental care, and vision care, are often paid for privately or through supplementary health insurance. But the core of the system, the medically necessary hospital and physician services, are covered for all Canadian residents. And there you have it, a bird's-eye view of the Canadian healthcare system. A system that is publicly funded, privately delivered, and consists of 13 provincial and territorial health insurance plans, each aimed at providing coverage to all Canadian residents. Now that you've got a basic understanding, let's delve deeper into how the system operates. You may be curious to know, how is Canada's healthcare system funded? Well, let's dive into that. At the heart of the funding lies the hard-earned money of Canadian taxpayers. Yes, both individuals and corporations contribute to the coffers through their taxes. This tax revenue becomes the lifeblood of the healthcare system, ensuring that healthcare services remain accessible and affordable to all Canadians. Now you might be wondering, does every Canadian pay the same amount? The answer is no. The tax contribution varies depending on one's income and province of residence. Those with higher incomes typically pay more taxes and thus contribute more towards the healthcare system. This progressive taxation structure ensures that the burden is distributed fairly, based on an individual's ability to pay. But that's not all. Some provinces in Canada also charge a health premium. This is an additional fee over and above the regular taxes. Provinces like Ontario had this system in place until a few years ago. However, it's important to note that these premiums don't directly determine the quality or quantity of healthcare one receives. Instead, they serve as an extra source of revenue to supplement the funding. Now let's talk about corporations. They too play a crucial role in funding Canada's healthcare system. Corporate taxes contribute a sizable chunk to the healthcare budget. This collective contribution from individuals and corporations ensures the smooth functioning of the healthcare system. In essence, Canada's healthcare system is a testament to the power of collective responsibility. It's a system where everyone, from the individual taxpayer to the large corporation, plays a part in ensuring that healthcare services are available to all who need them. So the funding is sorted, but who exactly provides the healthcare services? Stay tuned as we explore the delivery of healthcare services in the next segment. Who's responsible for treating you when you fall ill in Canada? A good question, and the answer might surprise you. In Canada, even though the healthcare system is publicly funded, the actual delivery of healthcare services is largely managed by private entities. This means that your doctors, nurses, and other healthcare professionals are not government employees, but instead, they are independent contractors or employees of private companies and organizations. This setup is not unique to Canada. In fact, it's quite common in many countries with universal healthcare. The rationale behind this is to leverage the efficiency, flexibility, and innovation that the private sector can offer, while still ensuring that everyone has access to the necessary healthcare services. So, what does this mean for you as a patient? Well, when you visit a doctor or a hospital in Canada, they provide you with the healthcare services you need. And then they build a provincial health insurance plan for the cost of those services. The doctors and hospitals are paid for their work, you get the care you need, and the cost is covered by the public funds. But remember, healthcare providers are not just limited to doctors and hospitals. There are also other healthcare professionals like pharmacists, physiotherapists, and mental health professionals who play a crucial role in providing comprehensive healthcare services. Moreover, there are a number of private clinics and facilities that provide specialized services like diagnostic imaging, surgical procedures, and many others. These facilities operate under the same principle. They provide the services, and then they bill the public health insurance plan. However, it's important to note that not all services provided by these private entities are covered by the public health insurance plan. There are certain services like cosmetic surgery or private rooms in hospitals that are considered non-essential and therefore are not covered. So, does this mean all healthcare services are covered for every Canadian? Well, not exactly, but we'll delve into that in the next scene. Stay tuned. What kind of healthcare services are covered under the Canadian healthcare system? Now that's a question with an answer worth knowing. Let's dive right in. In Canada, the healthcare system, also known as Medicare, primarily covers two types of services: hospital services and physician services. If you're a Canadian resident, you can breathe easy knowing that your necessary hospital and physician services are covered by the public health insurance system. Need to stay in a hospital? Medicare's got you covered. Need to consult with a doctor or a specialist? Medicare's got you covered there too. However, it's also important to understand that while the Canadian healthcare system is extensive, it doesn't cover everything. Some areas fall outside the purview of the public health insurance system. These include prescription drugs, dental care, and optometry. Prescription drugs, while essential to many, are generally not covered under the public health insurance system. Instead, most Canadians rely on a mix of private insurance and out-of-pocket payments to cover these costs. Similarly, dental care, though crucial to overall health, is not typically covered by Medicare. Many Canadians have additional private insurance for dental care or pay for these services directly. And then there's optometry. Eye care services, such as eye exams for adults and the cost of glasses or contact lenses, are not covered under the public health insurance system. However, there are exceptions for certain groups, such as children and seniors, who may receive coverage for these services. In a nutshell, while Canada's healthcare system provides comprehensive coverage for hospital and physician services, there are gaps when it comes to prescription drugs, dental care, and optometry. Many Canadians supplement their public health insurance with private insurance or pay for these services out of pocket to ensure they have access to all the care they need. Great, we've covered a lot about Canada's healthcare system, but what makes it unique? Well, that's a question for our next scene, so stick around. What sets Canada's healthcare system apart from other countries? Now that's a question that deserves a thorough answer. So let's dive in. One of the unique aspects of Canada's healthcare system is the principle of universality. This means that all residents of Canada have access to medically necessary healthcare services, regardless of their income level or employment status. It's a principle that's deeply ingrained in the Canadian identity, and it's something that sets Canada apart from many other countries, where access to healthcare can often be tied to wealth or employment. Another standout feature is portability. If you're a Canadian resident and you move from one province to another, you don't have to worry about losing your healthcare coverage. Your health card from one province will be accepted in any other. This is a remarkable feature, providing a peace of mind to those relocating within the country. When we compare Canada's healthcare system to those in other countries, it's important to remember that each system has its strengths and weaknesses. However, the commitment to universality and portability in Canada's system is a testament to the country's belief in healthcare as a fundamental right rather than a privilege. The focus on preventative care, the integration of health services, and the commitment to continuous improvement are other aspects that make the Canadian healthcare system truly unique. These elements not only ensure the health and well-being of Canadians, but they also contribute to the country's reputation as a global leader in healthcare. And that's a wrap on Canada's healthcare system. It's a system that's not without its challenges, but its unique aspects and commitment to the health and well-being of its residents certainly make it stand out on the global stage. Remember to like, share, and subscribe to our channel for more content like this. Thanks for watching.